Okay, I think we're good to start. Good morning, good afternoon, or good evening to everyone, wherever you are. Welcome to our HDC webinar. Today's session will highlight the situation, challenges, and opportunities in monitoring capacity in humanitarian fragile settings. It will also reflect on WHO's work in countries with fragile contexts to understand what works well and what does not. And at the end of the presentations, an interactive Q&A will follow. So our guest speakers today are Abdihamid Warsame. He's a technical officer in the Health Information Management Unit here at WHO in the EMRO region. His work centers on strengthening the region's monitoring and evaluation of emergency response. Also, we'll have Ahmed Osman. He's a technical officer in the Health Information Management Unit, also in WHO EMRO. He works on strengthening the region's monitoring and evaluation of emergency response as well. We'll also have Osman El-Mahal. He's the team lead for surveillance and response monitoring within the Health Information Management Unit here also at WHO EMRO office. Last but not least, we have Chiara Altare. She's a faculty at Johns Hopkins Bloomberg School of Public Health, working at the Center for Humanitarian Health. And her work focuses on monitoring and evaluation of public health response in conflict-affected areas, infectious disease outbreaks, and health service delivery in humanitarian settings. So before we start, just please note that this webinar is being recorded. I see a question about that, and would like to make this recording available via our HDC website for the benefit of the ones who could not join us today. And now I'll give the floor to our colleagues in Cairo, who will introduce today's theme and kindly agree to facilitate the session. So Cairo colleagues, over to you, and thank you very much for being with us today.
Thank you so much, and welcome colleagues and friends for joining us today in this webinar. And we are so happy to share with you today our experience in this work. And I will try today to go through the journey we had regarding the response monitoring in the humanitarian setting. And just before we jump into the technical details, we are working in the regional office of WHO, which is supporting Eastern Mediterranean region. We are supporting 22 countries, and we do have like 3 distinct categories of countries. We do have a well-resourced countries, if I can say, like those are the Gulf countries. And then we do have a bunch of fragile conflict-affected countries that we do have like countries like Somalia, Syria, and Yemen, Sudan, and those countries. And in the middle, we do have countries like low and middle income countries like Egypt, Morocco, and Jordan, and this stuff. So we do have a quite diverse range of countries that we are serving, and that make it for us more difficult because we don't have one size that fits all, because we need to customize our intervention and our support to those countries and to fit their needs and requests. Our priority in the support that usually comes to those FCV countries, and we're working this project mainly to support those countries in trying to get better understanding about what is happening regarding the emergencies that's happening. In the few minutes later, Ahmed will give you more detail about the emergency situation, but I can assure you that EMRO is one of the hottest areas regarding emergencies, and we're one of the volatile area for emergencies. We call it the supermarket of disaster. We have everything ranging from outbreaks and all infectious diseases, natural and man-made, and everything that people you can think about in emergency in health sector that we are facing and we are encountering on a daily basis. Lastly, mentioned that this is devastating earthquake that's happening in Syria. So we do have plenty of challenges, not only the emergencies, but also in those countries, the challenges of having disrupted health services and health system that is not able to cope with this increasing demand of these emergencies. And we are trying to work with the 3 stream of data in order to make sense, guiding our decision-making process for emergency response. The first one is the event data itself, and how we can just quantify the magnitude of the event, and how we can make sure that we do have the right linkages between the intervention that we are making and how does it affect the event dynamics in itself. And also we are struggling to quantify and to measure not only just the process of the intervention, but what is the output, what are the outcomes, what are the impact of those interventions. It is quite challenging. We know the theory of the M&E that we need to look for the input, process, output, outcome and impact. It is easy to say, but it is very, very difficult to implement, especially when you are working in protracted emergencies and when you're working with FCV countries. And then we need to make sure that we do have enough contextual data that help us make sense of the data and the information that we're gathering with regard to event data or with regard to the response data. So these three pillars of information, that the event data, the response data, and the contextual data, we're trying to mix them up, come up to support the decision-making process. It is, as I mentioned, that it is easy to say conceptually, but trying to implement that is very, very, very difficult. And there is a lot of feasibility challenges that we are encountering. Some of them we managed to overcome. Some are still in the process of how we manage them. So we will end up like, this is what we want, but this is what we can do. And that gap, we need to have more engagement of a stakeholder in order to expand what we are doing in order to match it with what we're supposed to be doing. So this is a platform we thank to our colleague in HQ that to give us opportunity to expose our experience with and share it with other partners to get your insight and your views. And also, if you are interested to contribute into this and to join our journey and trying to expand the reality and to make it a little bit matching what we're supposed to be doing, this is most welcome. And I think at the end of the presentation, we'll have like the way forward, and we will have like how we can engage other partners into this. And this is I think one of the objective of this webinar. I think I will stop here, and now I will give the floor to our colleague Ahmed Usman to take us and the colleague to take us through the presentation and how the journey started and what are the challenges that we're facing, what are the solutions that we implemented, and how we're looking for the future and how we will implement this with engagement of other partners. Over to you, Ahmed.
Thank you very much, Dr. Usman, and thank you for the audiences or participants. My name is Ahmed Assaid, and I will take you through the first few slides of the presentation, and I will come back the last few slides on the presentation. So the content of the presentation would be categorized in these five main sections. We would talk about the background or an information about the emergencies that the region is facing and their impacts in the introduction, and the challenges that we have in this region. The third bullet point or the section would be what are the solutions or interventions that have already been done. And we would then focus on what EMRO specifically is trying to do in terms of improving the response monitoring, which is and developing a framework or strategy. And then we'll talk about the in addition in relation to the operational as well as the strategic challenges and the way forward that we are trying to take it. This is a brief summary of the hazards and emergencies this region is facing. On the left side of the screen, what we see is the non-infectious hazards or emergencies the region is facing, and you can see that 9 countries in this region out of the 22 is humanitarian graded emergencies, and 9 out of the 22 is facing some sort of civil unrest and conflict. We have in the region, excluding the recent earthquake that we are dealing with now in Turkey and Israel, Syria. We have 5 countries that are affected by natural disasters like floods and earthquakes. On the left side, we have the reason why we said the 22 countries in one way or another is all affected by some sort of emergencies or events is we have 81 acute, currently active public health events. We have 13 diseases that are causing 41 different outbreaks across the region. The COVID is also in addition to the burden. So we have, as you can see, a higher proportion of CFR than for COVID than the global level. So due to the challenge, that number of the magnitude of emergencies we are facing, we can see it's reflected in the impact of the population in the region, as well as the already overwhelmed health systems or overstretched and under-resourced health systems is struggling to cope with all of those emergencies. If you can see from this data, 57% of the population of the region lives in those FCV countries. We have 5 EMRO countries, which is on the top of the forcibly internally displaced people. We have more than 111 million plus. This is excluding, this is as of 2022, which is before the earthquake, and we can easily expect that to be more than 120 million plus. 4 of the 15 countries that are affected by the climate change or vulnerable for the climate change is also in this region. In the list of the 5 top countries that's that attacks against healthcare have been, 2 are also in this region. So the nutrition, due to the events of the food insecurity and droughts and floods, also EMRO hosts 5 countries among the top 10 countries in terms of the food insecurity or IPC. So the question we are trying to ask here is, the impact of the crisis in many cases are not fully quantified or cannot be even quantified. So we basically focus on the accessible death, measurable data, locations that we can measure the deaths and quantify the figures, but we usually don't look the impact from from the overall magnitude of the crisis that we have. Just to continue with this graph shows how the increase of the needs of the burden in the region is due to those different emergencies is increasing so fast. So we have, as we can see, from 2020 until now, we can see more than 90% increase of the population in need of humanitarian help in this region. With this, I would hand over this quick introduction showing the background of the problem that we are facing in this region. I will hand it over to my colleague, Abdelhamid, Dr. Abdelhamid, who will take it from the next slides. Over.
Thanks, Ahmed. Can I confirm that you can hear me? My connection is not so stable.
Loud and clear. Go ahead, Abdi.
Great, thanks. Thank you. So just building on from what Ahmed said, I'm going to try and focus a little bit more about the challenges that we encounter specific to monitoring and evaluation. So Ahmed gave an overview of the humanitarian emergency situation in the region. I'm going to focus a little bit about the challenges regarding the MNE. So in essence, there are some mechanisms at both national and regional levels in the region, but they're quite, or they have some substantial limitations that we need to address, and we'll go into a little bit more detail about that in the coming slides. But some of the main challenges center around the lack of standardization, different countries using different indicators, making it hard to sort of have an overall picture. There's also a lack of focus on outcomes and results, and especially absence or not so clear targets In addition, some of the countries, many mechanisms don't have a clear baseline from which to judge progress, and don't really have use of global standards. And so they're reliant on using absolute numbers to track activities and to monitor activities. And in some situations, this ends up with the use of some indicators that may not be so robust, but are convenient just because there is a need to present some information on the response to any particular emergency. And then, of course, the issue of evaluations are, also a challenge in terms of being ad hoc and being very much dependent on a particular crisis or a particular country's response. Next slide, please. And again, so a lot of this comes back to, the issue of standardization. And in some of the FCV countries that we deal with, population denominators are quite hard to really come by. Strong population denominators, and where they do exist, sometimes they don't exist in a disaggregated way, so that we can be a little bit more precise about who we're reaching with our activities. And then, of course, given the scale of the crisis and the limitations on, maybe human resources or otherwise, there isn't that much capacity for analysis to do a little bit more deeper analysis. And so it's much more about reporting sort of the raw figures. And then when beyond the reporting, there's also a poor linkage between what is reported and how that feeds into the decision making. There isn't really much of a strong sort of protocols in terms of how we use this information that we gather about the emergencies, about our responses in a systematic way. And so a lot of it has been leading to what we think of as ad hoc feedback and use. And we also have some of the same challenges at the regional level to strategically monitor the response. Next slide. Next. So what we're really trying to do here in the region is to support the emergency response in terms of efficiency and effectiveness and timeliness through strengthened monitoring and evaluation systems. And we want to do this both at the regional level, scaling up what we are doing, but also strengthening national response monitoring capacities. Next slide. So here is just a short diagram of the way that we are trying to move in the region in terms of addressing the many challenges, and we've developed this response monitoring sort of strategy, and we have strategic priorities both at the regional level, again, and at the country level, as well as promoting sort of the data sources. And so there's quite a few work streams that we are trying to scale up and strengthen, both at the country level and at the regional level. But for the purposes of this particular presentation, we're going to go a little bit more in depth into the regional response monitoring framework and the development of the key performance indicators that we have initiated with the colleagues from Johns Hopkins that you see here circled in blue. So next slide. So I'll hand this floor back to Ahmed to sort of give us an overview of how we've built on existing systems, because it's not all doom and gloom, and we want to make sure that we acknowledge the existing systems and the strengths before we go a little bit more into the regional response monitoring framework. Back to you, Ahmed.
Thank you very much, Abdul Hamid. This we've seen the rationale of what we're trying to do now. Zooming into the regional response monitoring framework, which is a component of the overall strategy that we are moving along, is when we will get the history and the background of the development of this strategy and the KPIs, the regional response monitoring framework, in the next slides. But we want to emphasize here that we're building whatever we want to do on the existing foundations for the KPIs. So what through mapping and assessment, what's very obvious and we know and we've learned is that there is coordination mechanisms that associating member states, WHO, other UN sister organizations, partners on the ground through different forums of sectors and health clusters. There's also thanks to the coordination of those forums, there's always most of the time frameworks that are developed for the humanitarian response plan, and in most cases they are in line with the response plans have M&E framework. There is a huge investment on surveillance that permits us on to monitor the health status of the population, especially on infectious diseases. In this region also, out of the 9 FCV countries, 8 have either robust and moving HIRAMs that has been there for a long time, or have started recently. For example, in Afghanistan and Iraq, we have recently implemented HIRAM. So HIRAM is continuously providing information that is very crucial for the response on resource and service availability. And finally, there is a huge data that's collected in across all of those FCV countries, or the country that we want to strengthen their monitoring capacity. And that data is obviously, as you know, all of you, that's communicated through different products and dashboards and bulletin and all of those. So the question that now we have is we're starting as an entry point identification of regional KPIs, but in the meantime also, as my colleague Dr. Kayara would show you after this slide, starting from the KPIs that we started as an entry point until now, we have dig more problems and challenges with evidence and through assessments than we thought of, like what can we do. So more on analysis, harmonization, use of evidence for action, standardization, extra. So with this, I will move on to the next slide, which I would give Dr. Kayara the floor to take us through from here. Over.
Okay, thank you so much, Abdi and Hamed. I'm Chiara from Altara from Johns Hopkins, and indeed I'm going to go a bit more into detail about the collaboration between the Center for Humanitarian Health and EMRO, which has started, as you can see from here, only in September 2021, and which builds upon previous initiatives by EMRO at the regional level in order to develop, as they were, as both as the 3 colleagues from EMRO were just describing. So this is a series of attempts and initiatives to improve the monitoring capacity within the region. And now we had the possibility to conduct this collaboration thanks to UK aid. And it was mainly a team, the colleagues from EMRO that joined the webinar, including Arafat that I see in the room, and from the Hopkins side it was mainly myself, Bill Weitz, who is also among the participants, and then Paul Spiegel, who couldn't join. And so what we tried to do was to build upon previous previous initiatives, but trying to take this attempt a bit one step forward and trying really to focus on performance. So we have been, we're almost using interchangeable the word monitoring framework and key performance indicators because but actually the focus of this initiative is really to look at performance. And so next slide then. And yes, and this monitoring framework really tries to look at the results. So while we recognize that it's very important to collect data on the input-output processes related to the implementation of a certain programs, for this monitoring framework, the focus has been on results, because often is the most difficult part, which though is crucial for identifying priorities and identifying areas where further investment and support is needed. So we decided to focus only on outcome indicators that would encompass both the response activities to humanitarian crisis as well as health status of the population in affected communities and areas. And as a general approach, we decided to highlight a set of thematic areas and sub-areas that are relevant and needed, and from which information is needed in order to have an understanding of the public health situation in a certain humanitarian crisis. And we decided to, you will see in soon the areas that have been jointly selected, but then we decided that for each area or a sub area, we will only identify one tracer indicator, which would represent the, or which would be used as an indication of how well either the response is doing or to provide an idea of the health status of the population. We certainly recognize that both we need more indicator at program or country level. So all the input and output and process indicators are certainly key to monitoring the implementations, but are not in the scope of the framework. And also, of course, we well recognize that there are probably multiple indicators that would be key in order to have an understanding of the situation, but in order to keep the framework relatively small and manageable, we decided to take the approach of choosing one representative indicator for a given topic. And so once the thematic areas were identified, it was decided that these thematic areas would remain the same across countries. So there is consistency across countries in terms of thematic areas, but we recognized also that the countries and the crises are very different, and some adaptations according to the context might be required. And so this meant that there is actually some flexibility in terms of the specific indicator that is measured in each country for a given area. And so this means that the analysis will be then conducted either at the indicator. So in every country, the analysis is conducted at the indicator level, in the sense that within country, we can assess the situation with the selected indicator. But of course, across countries, if the indicators are different, the comparison or the, there is no real comparison made, but if there is the need to understand how the situations vary across country, then the assessment will be done at the area level, so the thematic area. One more point is that this is a monitoring framework, and so the indicators are have a certain frequency, and it's actually, depending on the indicators, it's mainly quarterly, plus some indicators related to outbreaks that are requested actually at a higher frequency. And so we decided that the only way to make this sustainable is to rely on existing routine data sources. And the idea being that the existing system can provide data more frequently, and this should be complemented or validated either with community, so population-based or facility-based surveys. But we refrain from suggesting to introduce new data collection systems, because it would have been complicated, and also because, as you will see at the end, there is actually already a lot of data that are collected, a lot of data systems, so it would have actually augmented fragmentation. Next slide, please. Thank you. Just briefly, so the monitoring framework, as I said, covers a broad range of services and health needs. As you can see on the right-hand side, we finally selected 9 thematic areas that span across different health system building blocks, preventative, curative, emergency services across sexual, maternal, and child health, as well as communicable, non-communicable diseases, IPC, and WASH. And so all these areas, as well as the individual indicators within the areas, have been identified through a consultative process, both within so within WHO at the regional and at country office, but then also across country offices in regional consultations, and then with the different national counterparts. So of course, the Ministry of Health has always been involved, given, as you will see, and we will discuss, many of the data sources are, of course, national, so data from national authorities, as well as different partners in country. Next slide, you will see the full list of indicators, and while it is well, we're not going to discuss every single indicator, but as you can see, you see the 9 areas on the left, and then we managed to basically select and include 25 indicators, which we hope is relatively, so it's a manageable number of indicators. And again, you can have a look at the indicator. I think the key messages from this list is that, first of all, per se, it's a small number of indicators. Many of the indicators are actual indicators that you probably recognize, in the sense that we try to use validated indicators that are regularly used. So if you see number 7 is the proportion of institutional deliveries, or number 8 relates to antenatal care, and if possible, we suggest to have a coverage of antenatal care for other both communicable and nutrition indicators are very standard indicators. But you will also see some indicators that might not be very common, and these, for example, under non-communicable diseases, the mental health, trauma, and diabetes, while there are indicators that are used often in population-based surveys or in health facility assessment, it was difficult to find them readily available on a monitoring, so for a monitoring activity. So they might be calculated with ad hoc data collection in every of the countries where we work, but they are not readily available on a quarterly basis, for example. And so in those cases, we came up with alternative indicators, in this case, for example, with an availability score for a given service, relying on HIRAMs. And so there are a few indicators that have been modified or adapted in order to ensure that they were feasible. And in fact, and next slide, the main component of this collaboration has been not only mapping and identifying already existing indicators, but then assessing the feasibility of each indicator. And because the ultimate goal of this framework was not only to have a very nice list of indicators, but to ensure that they were feasible. So we wanted to go, or we were ready to accept some flexibility and some changes in the indicators in order to have an indicator, so in order for the indicator to be feasible within each country. And so we conducted both remote and then in-country visits to 4, we call them pilot countries, in the sense that we started with occupied Palestinian territory, Yemen, Syria, and Somalia. And we went and assessed the feasibility of every indicators one by one, discussing with the relevant counterparts the type of, the definition, the frequency, the data source, and the availability of sharing this data on a regular basis. And again, the results were actually pretty different across countries, but we can see some common trends, and more or less 1/3 of the indicators, or between 1/4 and 1/3 of the indicators, were actually feasible as they were initially included in the framework. 1/3 required modifications, and these modifications ranged from very minor modification to, a word in the definition, to some to the need to align with existing data sources. And the main data sources that we rely a lot on is HIRAMs. And so we needed to use basically the definition of the service as provided in HIRAMS and then calculate a sort of availability score, as I mentioned earlier. And some other indicators really were not even possible with HIRAMS, and so required some the identification of a new indicator. And then again, between you can see 8% to 32%, so a big number of indicators still were not feasible, and so we require further work in country to see whether either the system can be changed or a new indicator can be identified. And next slide, please. As you can imagine, the countries are very different, and so the challenges that we identified in each setting were also different, but we tried to summarize some considerations across countries. And what we learned, for example, is that maternal health and immunization indicators tended to be feasible almost across all settings. And the same for surveillance, especially for the number of cases and number of deaths, in order to calculate a case fatality rate for ongoing outbreaks or of preventable diseases are usually available. It may change in terms of functionality of the surveillance system. So there are two indicators looking at the basically the timeliness of the investigations and the completeness of reporting, and these are so available at varying levels. And then other indicators were on the contrary much more complicated to find, and these include essential medicines, as I said, chronic conditions, so mental health, trauma, and diabetes, as well as gender-based violence. This was one of the few indicators that across countries was very challenging. Mortality depended on certain countries. What we noticed was the countries that have small-scale surveys being conducted on a regular basis that include the mortality module are, of course, better off. So, for example, in Somalia, there is actually mortality data more available than in other countries. IPC and WASH were feasible if we align with HIRAMS. So there has been a lot of work conducted in both for IPC and WASH with regard to the definition and standardization of indicators. So that I think, so as you are probably aware, there is the WHO UNICEF joint monitoring initiative. So there are standard indicators that are more and more used, but mainly with ad hoc data collection. And so it was difficult to find them on a more regular basis. And this is one of the problem, I would say, across indicators. So we needed to adapt, because often the standard indicators are used for ad hoc data collection and are not available in a monitoring system. And then finally, as I said, nutrition. Again, as you probably all know, there is a long history of initiatives trying to improve standard definition and standardization of indicators for nutrition. And so it was actually both easy to find the usual indicators, so the program performance indicators, as well as prevalence of acute and so global and severe acute malnutrition. And they were available, though, if in the countries where malnutrition is a public health problem, and less so if so, for example, they were less available in Palestine. Next slide, in which I briefly comment on so the challenges and sort of lessons learned issues that certainly will have to be addressed in the future. Again, it was very insightful to see how crises are different across countries, and so certain challenges are very context specific, but also some were across settings. So first of all, the fact that the entire monitoring framework is focusing on performance, and therefore we need indicators. So we need an indicator with a numerator and a denominator, and we try to move beyond the absolute numbers of. So it's very common to have absolute numbers of consultations, absolute numbers of vaccination doses delivered, but we try to add in a denominator, and this, of course, has important challenges, both in terms of population data availability, but also really the mentality of calculating indicators, because often what we saw is that denominators exist and are used at different moment in the operational planning cycle, but not for assessment. So, for example, there are population estimates that are done and used by the UN and international community for planning, but then they are not used for monitoring. And we recognize the complexity, especially on population estimates, but I think there is something that can be said about increase the practice of calculating indicators. And then a second constant was the fragmentation of the system. So we were actually positively surprised in many of the countries in which we saw that a lot of data was recorded. So there are data systems in place that are, however, functioning in sort of silos. So there are different level of maturity of the health information system and different level of functionality. And so it was just, the data is available, but it needs to be found and then integrated with other data. And even though, as we were saying, certain areas are really struggling to provide data, both in terms of mortality, essential medicine, and gender-based violence. So in a few countries, there is more need of harmonizing and coordinating than adding data sources. And then on the other side, we also saw certainly the need for additional support and additional resources, both in terms of continuity of work to avoid staff turnover, but then also in terms of data analysis and data use. So we also saw that even in the countries where data is available, there is little motivation to and little practice to analyze the data and to provide the data to and to use the data for decision, both at programmatic and strategic level. And so this is also something that we were trying to discuss and see what could be, how could an improved monitoring help, defining and start that in almost institutionalizing the utilization of data, which of course would also help in improving the quality of the data collected. And with that, I give the floor back to Hamed in Cairo. Thank you so much.
Thank you very much, Chiara. So I think we came to we've mentioned the challenges that in terms of the operationalization of these KPIs that we have identified at regional level, and we were trying to address some of those challenges, and thanks to different stakeholders on the ground across the organization, WHO and other partners on the ground, we were trying to address mainly on currently the standardization, which is the section that we have now discussed, and standardization of the KPIs at regional and country level, which is the first section that we are working on now. In the meantime, this team or the regional WHO in EMRO is also is working on how better we can support the sources of the data or the information systems. And if you can see the HIRAMs, thanks to WHO HQ colleagues who are leading on this, we are working on that. How we can expand HIRAMs in the region, and because it's a credible source of value source of information for the KPIs. And we have mentioned in the previous slide that across the countries, that was the pilot countries we've looked at, there is a problem of monitoring mortality, whether it's surveillance on mortality or assessment, or it's not so frequent. We have not had evidence. So this is also an area that's now that's been led by the WHO and UNICEF colleagues in Somalia, for example. They're trying to to look at it, and we established the London School to look at the mortality. So we are also, the regional office is also trying to support on that. Here in there's also the health information, the HMIs or routinized information system across the FCB countries is also a valid source of it collects huge information, but there is challenges on the digitalization, and our colleagues across the WHO SID department and as well as Oslo University are working with us on this on the DHIS2 and how the DHIS2, both the HMIS and FCV can be strengthened content-wise, but in the meantime also how we can support the digitalization process. I know other other UN agencies are also and partners are also involved in this. For WHO, we are specifically now supporting the repository, health data repository, that we are trying to address the fragmentation, specifically on centralizing these KPIs. The sources of that would fit into these KPIs in one. The details are, we want to have the mechanisms in place which support, establish the reporting lines, develop the tools, and develop the capacity building and provide capacity building trainings on that. And lastly, for this specific operationalization of the KPIs that we've tried, we still have we're trying with Hopkins to develop, as Kara said, data quality is a big issue. We collect huge, but during the analysis, you'll see a lot of quality issue. So we're trying to do data quality verification guideline or tool that we can use to complement with the routine data that we would in the future collect for this KPIs for the regional level. With this, I would come to the last slide of the webinar. This is the key message or takeaways, which is we know the needs are growing every day, and even the slides that we've shown recently, Turkey, and the needs are we all know it's increasing in our region. Number two, there is a need to invest. There is investment happening, but we would like to call on to increase in that, and especially emphasis to be given the response monitoring capacities, both especially at country and as well as at regional level. We also, the takeaway would also be a strong collaboration is necessary across the organizations, across the partners, and we are to address this magnitude or growing needs on the ground. In short, the exercise that we are trying to do, or we've already did with Hopkins, and we would welcome also future partners, is how can we look, what can we do differently to ensure the investment that's becoming so scarce on the humanitarian response in this region be measured adequately. With that, we conclude, and thank you. Back to you, Usman.
Thank you so much, colleague, for this insightful presentation, and you took us through the journey of how we can try to implement what we know, how things should be done, and what we can do it on the ground, especially in the context of these challenges in the region where we do have, as Ahmed mentioned, that almost half of our countries are FCV countries, and that it is not easy to implement what we know as the theory into implementation. So we work with the feasible solution that we can navigate through those challenges in order to have something on the ground to help the countries and to help also stakeholders in order to monitor and to keep an eye on how we are doing and how is it effective and how efficient it is in monitoring our intervention. And it's not an easy job to implement. I think now there will be chance for Q&A or questions from the group. If you have any question, you can put it on the Q&A box. I think also Karina can help us with that, because we cannot see all the questions. So if you have any questions, maybe specifically for this presentation, or if there is any general question that we can think of it together and try to address, that would be great. Over to you, Carolina, if you see anything from your side.
Thank you, colleagues. Yes, I think we do have, Barakisa, I see your hand is up, so I will just enable your mic. So please, whoever has a question or wants to make an intervention, just raise your hand and then state your organization and your name. Thank you. Go ahead, Barakisa, the floor is yours. Thanks.
Oh, mistake, sorry.
Oh, okay, no problem. So anybody has any questions? Okay, I see a question in the chat. So Hossam is asking to share the KPI list, please, if possible. So yes, we can definitely circulate the materials, the slides, and if it's okay with the colleagues. So over to you, colleagues, if you can share the KPI list and if you have any additions to that. And whoever else in the audience has a question, please don't hesitate. Okay, we have a question from Craig. Can you give some more information on data sharing from NGOs or other UN agencies in humanitarian situations, and how do you ensure standards and transparency? This is from Craig Burgess from WHO HDC. Thank you. So over to you, Chiara and Osman and EMRO colleagues.
Can you repeat again?
Yes. So can you give some more info on data sharing from NGOs or other UN agencies in humanitarian situations? And the second part of the question is, how do you ensure standards and transparency?
So, I mean, this is Arafat. I'm in charge of HIRAM's coordination in the regional office. So we collect data from partners through different platforms. So we have the health cluster coordination mechanism, which we collect the data. So the data are, we have the HRB data that are being collected, as well as the initiative of HIRAMS that is collecting the data, for example, in Afghanistan, where we have the standard questionnaire which collecting the data from the partners. So those are coming again to the response monitoring indicators, and it's being used for the monitoring purposes. Ahmed can answer regarding the transparency. Over to you, Ahmed.
Well, I mean, the question I think is too deep in terms of, I mean, at country level, how the linkage, Arafat mentioned the linkage between the reporting lines between the partners through the cluster, and what these KPIs would be helping us, monitoring will be helping us is to effectively, I mean, and you know, allocate the resource in not only WHO but also the cluster and the partners on the ground. So the transparency comes along with you know, having evidence and using that evidence for action, and be accountable to whether it's the affected population or the funding organizations. Over.
Yeah, I think just to complement on what our colleague mentioned, that each country that they do have different contexts, but some, and as we mentioned, that there are some customization is being done for this framework to make sure that it fit the purpose. So in some countries that NGOs and partners are the main source of information. So we are relying on the partners to get the information, especially for the HIRAM. So for whatever intervention that they're doing, so they will be the main source, because the government sector may not be very well enough in implementing the intervention. So we rely on the partners. So this is one of the situations where we mainly or solely depending on the data from partners and NGOs, and in that one. Data transparency is one of the challenges that we are facing, because, you know, in the context that where we're having this conflict and problems, sometimes it could be challenging, it's hampering the quality of the data that we are using. And this is one of the issue that we witnessed during our work. So the process give us a lot of learning experiences about the real challenge that you may face when you are collecting data. And as I mentioned before, that it is easy when you're putting the drafting this on paper, but when you're implementing it, you'll face a real challenge that you think it is going to be under the assumption that's going to be easy process of collecting data, but it is quite challenging. I assure you. Over to you, Caroline, if there is any other question.
Thank you so much. I don't see any other questions on the chat, but okay, we just got one from Nabil. How would that work feeds into the planning aspect, HRPs, and to the collective monitoring intersectorial? So I'm going to repeat the question. How would that work feeds into the planning aspect, HRPs, and to the collective monitoring intersectorial?
Thank you. Give it to Ahmed.
Well, I think the first, this is the first step, which is standardization, or helping the us in WHO EMRO to standardize, to have a standardized indicators. But in that process, we've also, I think, have seen that standardization could be also beneficial to the countries, and through when the question of how this would fit into the HRP process, this would make more sound indicators standardized and available to be used during the exercises of the HRP and the HNOs. And that would, we have said in the beginning, there was some scenarios during the acute phase, we have indicators that's so relevant during the acute phase that we use, like what I say, like the people reached, but we sustain to keep those indicators even during the protracted phases, and we tend to be monitoring the operations, even though we may time has passed and we may need to move back and see, in addition to the operations, look the impact. So what we are trying to standardize, we believe, would help also the country offices and member states and UN, other UN agencies, and any partner on the sector would be able to have the benefit those standardized tools and indicators, and that would help make easier for. We started with the humanitarian event, but later on, for all events that happen, standardized, readily available indicators that can be used for the planning processes. Thank you.
Thank you, Ahmed. And I just to complement on Ahmed's comment, that I think in the presentation you saw that one of the challenges that we found when we are working with the country, that there is a problem of linking the M&E with the decision-making process. And this is quite challenging, because all this work and all this efforts being exerted, but at the end of the day, we need this to fit into decision-making process in order to make changes. But usually there is a gap here, and we need also to work on that. We identify this as one of the challenges, and we need to make sure that, okay, whatever indicator that is telling us, we need it to inform into the decision-making process. And planning is one of the decision-making mechanisms that, okay, how this will be translated into action in order to improve in the future response or in the planning process. So we are very aware of this bottleneck, and we are addressing it into not only just collecting data and making indicators, but also how we can overcome, how we can change the culture. People like just up to making decisions without having an evidence or without relying on data. We need, because they do have some sort of whatever justification, that data quality and this scarcity of data, so they jump up into making decisions and just making planning. But we need to create the culture of evidence-based decision making and evidence-based planning process, and this is going to be part of our launching of this exercise with the countries. Not only just collecting data, also to make some sort of awareness with the decision maker and also the planner. They need to rely on data, even if it is low quality data, even if it is a scarce data. We need at least to see what kind of data that we have, and to create this kind of culture of relying on existing indicator and existing data in order to help them in the planning process.
Over. Maybe Kiara and Abdulhamid are also online if they want to add anything. Over.
Yes, please.
No. So nothing to add from my side.
No, that was a comprehensive answer. Just to, well, you can also type in the chat messages. So I'm just trying to also provide some answers directly in the chat, if that's okay as well.
Okay, I see a hand up from Samuel. Samuel, you can just go ahead and you have the mic. Samuel Petragallo
Yes,
from Herons Initiative. Yes, go ahead, please.
Sure, can you hear me? Yeah, thank you. I've actually posted the same message, the same point I wanted to make in the Q&A in the meantime, but since I have the floor, I'll very briefly, first, thanks all for the work and the great presentation. And nice to see that that HIRAMS was found to be a main potential contributor to response monitoring. As a matter of fact, response monitoring is one of the objectives we've set for the initiative to start with. So it's actually reassuring to see that things are aligning. I just wanted to react on this, on the notion and the importance of standardizing our practice. I think that has come across several times, including through a question from one of the participants, both on standards, partners' contribution, and transparency. Just to say that those are really pillars of the HIRAMS initiative. As Arafat was mentioning, in Afghanistan, all of the reporting is happening through partners. And we're really trying to improve the transparency around the process as a means of improving quality as well. So it means that all data contributors, all partners actually get to see the contributions from others. And we're hoping for some sort of a peer-to-peer positive pressure is how we normally call it, so that the overall process improves in quality, and so does the data. One very last point, I think, on standards, which I think is of importance here. You've highlighted, I think, in the presentation that for some of the indicators on WASH, you noted some misalignment. And I just wanted to point out here that we also need to be aware that there's still standardization work that needs to happen within the HIRAMS initiative itself. And what I mean by that is that the actual standards that we have at the global level do take into account the joint WHO-UNICEF monitoring and the WASH fit in particular. So the questions that have been developed as part of the standard were developed with the colleagues from the joint monitoring and in line with the WASH fit. But you're right, in practice, we still have in a number of countries what we call HIRAMS-like processes, which are sort of inspired by HIRAMS, but not necessarily, if you like, following all of the standards and the key principles of the approach. And so within that small part of response monitoring that is HIRAMS, we ourselves still have a lot of work to do in actually standardizing our practice, and which is why maybe you've seen some discrepancies there. Thanks a lot.
Thank you, Samuel. This is very insightful. I don't know. This is very good intervention. I don't fully agree with you.
Okay, so maybe we can take another question. This is from Mark Herringer, Health Sites. Does HIRAMS have a data policy link?
Come again?
And this is from Mark Herringer from Health Sites. Does HIRAMS have a data policy link? Maybe Mark, if you want to just go ahead and kind of elaborate a bit more on your question, you can just speak. I will just yeah, I'll enable your mic.
Hello?
Yes,
okay.
We can hear you.
Yes.
Please go ahead.
Yeah, yeah. So Health Sites is building a baseline of health facility data with OpenStreetMap, which has an open data license associated with all the data, and it's part of the Creative Commons. And so what I'm interested in understanding is how we can support HIRAMS and the WHO through the Creative Commons and data sharing. And obviously there is a complexity to that HIRAMS deals with that OpenStreetMap doesn't deal with. But I'm curious to know if a policy document has been established that governs the data HIRAMS is publishing, so that we can, for instance, look at the Creative Commons license or the data license associated with the data. And then I suppose this as a follow-up would be engagement with the OpenHIE community around data sharing protocols. Okay, I'll leave it there. Thank you very much for the presentation.
Thank you so much, Mark. I think Arafat will be responding to this. Thank you so much, Mark. So thank you very much for this question. So within the HIRAMS project, we conduct those projects along with the project owner. So the project owner can be the cluster, it can be the member states in the different countries. So with that, we always encourage the project owners to have a data sharing protocol in which they can, receive the data request and also answer this in a very transparent way. However, from the regional office side, we are providing the support mechanism, providing the guidance to those project owners, and because they are the data owners. We don't really own the data at the regional or the headquarters site. We just facilitate and provide the technical guidance and technical expertise, if you like, to those countries or to those project owners. So we have developed several protocols for data sharing, so to ensure that this process is formalized within the countries or within the clusters. So this process is documented as well. So requests are coming in a very transparent way, and then we can respond to that. Along with that, because the many times the data can be translated in I would say, in an improper way. So a person who would take the API data will accumulate the data not in the proper way of doing the KPI. So to make sure that this is happening in the right way, we ensure in those protocols that the analysis and the outputs of such data will be governed with this data sharing protocol. I would let also Samuel to complement. Samuel Petragello, he's online.
Thanks a lot, Arafat, and thanks, Mark, for the question. Very briefly, and you've put it perfectly right, I think, Arafat, is the main challenge for us is making sure that people can access the data in the form of analysis, that people can actually answer their questions. I think, we all get the value of open data, and we're trying to promote that data be shared as openly as possible. But I think we've also seen, maybe in the last 10, 15 years, where this has developed a lot, that a number of issues come along with this. And one of the aspects we're really trying to address through HIRAMS is the accountability. So whenever we're sharing data sets openly on the web, to a certain extent, the accountability behind that fades off, if you want. What we have through the HIRAMS process is every data contributor is tied and responsible for the data items that they're providing to the system. And we're making sure through this process that this accountability remains. So we're working on data protocols. The bottom line, as Arafat was explaining, is that this data does not belong to WHO in any sense. We're facilitating a process, and each subset of the data belongs to the data contributors. And that makes having data sharing protocols that cut across difficult. But because it would mean basically getting the same agreement across all of the data contributors. However, again, what we're really trying to make sure is that anybody who has a question to answer in terms of what services are available, where are the gaps, which barriers are we facing, that all of those data consumers can access the online dashboards, can access the report, can access all of the material they need to be able to answer their questions, even potentially ask for some specific analytics to be run by the coordination cells at the country level. I think that's probably the model we're headed towards now, if that answers your question. Thanks.
Over to you, Carolina.
Thank you, team. Thank you, Samuel. So an interesting question from Nabil Tabal about scaling up this kind of experience. So is there an appetite from other regions in terms of expanding the work and learning from the EMRO experience? So the team, and maybe Abdi can take this question. I see you were already responding, but it'd be good to share the answer with the group. Thanks.
Yeah,
okay, Abdi, go ahead.
Yeah, thanks, Nabil. I think we were, and correct me if I'm wrong, the other colleagues, we were hoping to take this initiative to a slightly more advanced stage before we would share the experiences. As Ahmed and Kiara mentioned, we were sort of in the pilot stage. But I think through platforms such as this, we were hoping to at least put this project on the map. But in terms of more formal sharing of information with other regions, it is certainly in our plans, but no specifics have been set. I don't know if Ahmed and others would like to jump in on that.
Well, I think the initial request, Abdulhamid, you've already answered, but just to add very brief, thanks, Nabil, for the question. The request started as like looking this region as a pilot, and this was an initiative at the beginning started by through how we can expand this to the other regions, and how coming from WHO, but also expanding to other health sector partners, how everyone can benefit from it. So it was a pilot that we conducted here in this region, and yes, obviously we cannot disclose the details, but there was appetite for some other regions. For example, some of the exercise, even though it was very early, because it was a pilot, but Afro and Euro for the crisis in Ukraine have cited and used some of the indicators that have been. But we have a second phase because we did a few countries now as a pilot, but we after finalizing the project, yes, there is an appetite for other regions to expand to other regions. Over. Thank you.
Thank you. I see Kiara has her hand up.
Yeah, I just wanted to compliment that Ahmed just mentioned. Indeed, while the idea, we didn't have formal discussion with the other regions. I'm sure you remember while we were in Yemen, I think we had a sort of sharing or a discussion with the WHO colleagues who were involved in the Horn of Africa response. I think just before then Abdi was deployed, and similarly there were more of an exchange of thoughts and approaches also with again Euro because of Ukraine. So certainly the idea would be certainly to share the lessons and what we did, but not yet it's not yet formalized. Over.
Thank you, Kiara. I see a last question from Hussam. Also, if you wish to kind of add anything to your question, just please raise your hand and I will enable the mic. So if there is guidance, so the question is if there's guidance to use this KPI while they are preparing country work plan for 5 years, and I think he mentions the country is Somalia. The other question is there a timeline for implementation, and how can they benefit from these activities? So just repeating, if there's guidance to use this KPI while they're preparing country work plan for 5 years, and the country in case would be Somalia, and if there is a timeline for implementation, and how can they benefit from these activities? I think kind of ties to what you were just saying about replicating the work or not, being ready for that or not, but please go ahead.
Okay, thank you. I will give, I think, the chance for Abdi and then Kiara to respond to this.
Thanks, Hussam. So in terms of sharing of the KPIs and collecting of the information, we've already been working with colleagues in Somalia after the mission that we undertook in October. In terms of guidances, that is one of the deliverables that we hope to have begun the development of in early this year. But I think that we would probably need to discuss the resources required given some developments in the last couple of months. But it is certainly on our horizon to develop the guidance. We've already begun engaging with the country office to start collecting this information. And I think we can provide more support going forward. But the modality, I think we would need to discuss with the country office about the specifics of that. In terms of the 5-year planning, I mean, that's great that you're thinking in such a time frame, and we're happy that this is being really considered, and we will definitely try and meet the expectations of the country office. But just to reiterate, the process is ongoing, and we're happy to kind of give more details and support in the coming days. We can also have a separate call if required. Thanks.
Chiara, thank you, Abdi. Chiara, do you want to add anything?
Not specifically. There's certainly SOP in the definition of so all the metadata is on our to-do list. As Abdi was saying, we have to clarify a bit timeline and resources related to that, but it's something that will have to happen. Over.
Okay, thank you so much, and I thank you, Hussam, for this. And I think Somalia is one of the good examples of the countries that we're working with, and I think Hussam himself will be spearheading this implementation, and we'll be working with Hussam to finalize this guidance of how to use the KPIs. And he's very operational that now we converted this into informing the 5 years plan. This is one of the questions being answered before that, how the KPIs will fit into the planning process. And I think this is one of the gaps that we need to jump in and provide support, making sure that whatever information that we're getting from those KPIs are just feeding into this planning process and to link that with the decision-making process. So thank you so much, Hussam, for raising this up. Over to you, Caroline.
Thank you. So a question just came in from Barakisa. Are there plans to share or integrate these data to the Digital Health Atlas?
Okay, Arafat.
So I think the main issue here is that we are trying to make the data available within the countries and available to the decision makers first, before sharing it to the public or to the Digital Health Atlas. However, this is not preventing this to be shared. Those data are owned by the countries. We're supporting the countries to on how they can develop and on the culture of the KPIs, on the culture of how to use those KPIs for decision making. And this is not preventing those data to be in any platform. And the idea, the main idea, is that if we start to create the culture of the use of data and the use of KPIs, the data sharing will come across that as well. Because the decision-making process is not only done at the country level. There are other decision-making processes that are happening within, like with the donors, with the different stakeholders as well. So I'm sure that once this culture is built, the data sharing will not be a problem. I hope this answers your question.
All right, thank you.
Over to you.
Thanks. I don't see any more questions. So any last chance for participants to ask a question or just raise the hand and make the intervention that you wish? Otherwise, I would just hand back to our panelists before giving some closing remarks in case they want to mention something, leave some contact or so. Last chance for questions. All right. We seem we're good. So back to you, colleagues, for any wrapping up, and then I'll just give some concluding remarks. Thanks.
Thank you so much. Just Chiara and Abdi, if you have any last word to say.
I just wanted to thank both WHO, the collaborative, for giving us the opportunity to present the work. Thank you, colleagues in Cairo, for the work itself and in the countries, and to all participants. And there is no email in the presentation, but feel free to contact Carolina if you want to follow up with the discussion. Thank you.
Thank you, Carolina. Abdi?
Just reiterate our gratitude for this opportunity and our willingness to share on our experiences for those who would like more information. Thanks.
Thank you much, Ahmed. You want to? Arafat? At the end of the day, I just want to thank everybody who joined us today and sharing your time to have give us a chance to present the journey that we went through. And I think studies show that there is some sort of lag between science and implementation. The optimistic studies say that it's 7 years, and some studies that it's 17 years that we translate this science into implementation and practice. And we know that it's not going to be an easy ride. It's not going to be an short journey. It's going to be a long journey that to translate whatever we know as a scientific background or what is a scientific fact to implement it on the ground. It's going to be a very challenging. So we will not expect to have result in this few months or coming year or the coming 2-3 years. This is going to be a very long process. And if we add the complexity of the turnover of the staff that on the ground and the complexity that's happening on those countries, it may prolong the implementation phase. So we'll be the key word here that we need to be persistent, that we need to make sure that we will not give up in order to make sure that there is some sort of evidence-based generation process in order to support the decision-making process and support the planning. And you need to make sure that we are providing consistently support to the countries and the people in need in order to make sure that there is an effective intervention that's been implemented and they are very efficient in making use of the available resources. And at the end of the day, thank you so much, Carolina, for hosting us and to having the opportunity to talk to this good crowd, very good, excellent crowd and audience. And we hope to see you in the future. And also to thank the FCDO for their support to this collaboration. And we also appreciate and have thankful appreciation for the Johns Hopkins for their collaboration in this area. And also we are open to have whoever interested to join us in this journey. The contacts will be shared through the email. If you are interested to participate in that, you are so welcome. Not if it is going to be only from just giving thoughts or giving advice or giving reflections or giving whatever that could provide some sort of support for this. You are almost welcome and appreciate it. Thank you so much for having us, and over to you, Caroline.
Thank you, Osman, Abdi, Chiara, all colleagues. So webinars, just a quick note that webinars fulfill the knowledge brokering role of the HDC, and then we encourage everyone who'd like to present on a topic of interest related to health data to reach out to us via HDC Secretariat at who.int. We still have some spots available for this year. Just a note also that I left in the chat box the link to our HDC website, which has a repository of HIS documents, among other things, and the link to the YouTube of the HDC, where this recording will be made available, as well as recording of past HDC webinars. And once again, thank you very much for having joined us today, and see you at the next webinar. Thank you.
Thank you. Have a good day.
You too.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Bye.